Hello, my name is Rafael Sanchez Puertas, and I am going to explain a critical review of the literature, moving beyond mental disorders towards a transdiagnostic approach, the case of alcohol consumption. This research is carried out by several universities, Universidad Pública de Navarra, Universidad Loyola Andalucía, and Universidad Técnica Particular de Loja. Alcohol is a leading risk factor for global disease burden, causing more than 3 million deaths, 5.3% of all deaths worldwide in 2018. Its negative effects affect the drinker himself, intoxication, cardiovascular diseases, dependence, neurocognitive and developmental disorders, among others, but also causes harm to others, accidents, violence, harmful effects of fetal and perinatal neuronal development. However, despite a long-standing and widespread influence of the diagnostic approach to alcohol use disorders and other related mental health and problems such as anxiety and depression, an increasing number of studies highlight that psychiatric nosology may no longer be fit for purpose in research and clinical practice. In this context, a transdiagnostic approach across traditional diagnostic boundaries may provide a new perspective into how to account for mental disorders. Unfortunately, the core transdiagnostic factors underlying mental disorders, such as alcohol use disorders, remain understood. Moreover, exploring sex differences are strongly recommended, particularly considering the sex differences in alcohol consumption rates. Recent research suggests that sex differences in alcohol consumption are now changing, with women approaching levels of risk alcohol consumption of men. For this reason, the aim of this study is to carry out a critical review of the literature to identify the main transdiagnostic factors involved in alcohol use disorders and examine gender differences. A literature review of studies published in the last 10 years was conducted using Web of Science, Semantic Scholar, PubMed, and Cochrane as main databases. Studies that were considered for inclusion in this review had to include alcohol consumption as a dependent variable and be empirical. Studies were excluded if they were reviews, editorials, or opinion pieces that did not provide original information or only reported qualitative data. This is a review adheres to the systematic search protocol recommended in the preferred reporting items for systematic review and meta-analysis guidelines. The following keywords and their combination were used: transdiagnostic, alcohol, stress, loneliness, psychological inflexibility. In this way, 15 studies were selected. Here we can see some of the studies, transdiagnostic factors, and how these are linked to alcohol consumption were determined. Many studies additionally analyzed other variables such as depression, violence, bullying, victimization, among others, in various samples. Based on the evidence reviewed, the three main key transdiagnostic factors related to alcohol use disorders and other mental health problems are psychological stress, defined as the perception of lack of control and predictability over the results of our behavior. Psychological inflexibility, defined as the tendency to avoid, suppress, or otherwise control the frequency or intensity of internal experiences, such as thoughts and feelings, even when doing so causes behavioral harm, also known as experiential avoidance. And loneliness, understood as perceived social isolation. In addition, gender differences were found both in alcohol consumption and in each of these variables. Although three main transdiagnostic factors have been determined, there is great heterogeneity in the way of measuring them, in the samples and in the predominant type of study, which is longitudinal. Therefore, these results should be contrasted with future research. It is recommended for future research to measure all these variables together and determine gender differences in its influence according to consumption levels. Finally, although transdiagnostic factors such as psychological inflexibility are studied in third-generation therapies to reduce substance abuse, psychological stress and loneliness must also be included, which have implications for prevention and intervention in problems related to alcohol consumption. Thank you.